It's a call that's telling me I'm here to serve. It's a need to make a difference in the world. 24 hours, day or night, these healing hands will make it right. Looking in their eyes, I know that I'm changing lives, changing lives, changing lives for the better, changing lives.
And hi again, everyone. Jim Knox back with another edition of the Best Docs Network, featuring some of the best physicians in the Dallas-Fort Worth area that help change people's lives, like our first doctor, colon rectal surgeon, Dr. Robert Cloud.
I was really scared because I couldn't figure out what was wrong, and I had never heard of anybody having anything like this before. It was interesting because when I walked into Dr. Cloud's office, 5 minutes after I was in there, he told me what was wrong. He hadn't even examined me at all. He just knew the symptoms.
Teresa Bagman was a 71-year-old female that came in with a 4 to 6 week history of a foul-smelling drainage from the vaginal area. The key elements in her history was that she had been told she had diverticulosis in the past, but had never had an actual bout of documented diverticulitis. She also had undergone hysterectomy in the past. That combination with a question of passing stool out of the vagina almost 100% leads to the diagnosis of a colovaginal fistula secondary to some disease process in the sigmoid colon. In Teresa's case, she had a complication of diverticulitis creating fistulas to both her bladder and her vagina, and surgery was going to be needed.
I was really kind of scared because I'd not been through that before either. I'm really a chicken when it comes to my body and surgery. I'm very frightened of it. And but I had them done. We watched it and said that hopefully he'd go in and do one surgery, but if the infection wasn't completely clear, then there might have to be 2 surgeries.
She underwent surgery, and we removed the diseased segment of colon, thereby disrupting both fistulas, and hooked her back together. And she's been rendered completely asymptomatic.
My recovery's really been easy. It's really been good. Once I had the surgery and that was behind me, I didn't have anything more to worry about. It was just a matter of concentrating on eating right and following Dr. Cloud's instructions and resting.
In this community that is growing rapidly, very young, growing population, sports injuries are just everywhere.
I was at my football practice and I played quarterback. I was throwing the football and I ended up hitting one of the linemen's face masks and my thumb just didn't feel good.
I've come to see Dr. Michelson for my left wrist being broken, tendonitis in my right elbow, and I dislocated my left pinky. So I've been in here quite frequently.
With Brock and Brady, I see them quite frequently. They're great kids, they're competitive. Sometimes it has been an acute injury, broken fingers and thumb, but sometimes it's a overuse situation.
We can come here for anything, even that's just a worry. Sometimes it's just the emotional part where you think you heard it, but when they tell you you didn't, it feels better.
It's very comforting when Dr. Michelson talks directly to you because you know he's trying to help you.
I think it's important to involve the patient in the discussion, to try to help them understand, because they're so focused on, I want to play in a game. But in the long term, I try to help them understand how the bone heals and how the body works, the potential problems they can have because of it, and try to carry them through that.
He's just like a friend that knows how your bones work, how your muscles work, and you can just come to him for reassurance. It's just really comforting to know someone knows what to do when you don't.
My thumb is 110%. I can move it even a little more now. After all the treatment and what they told me to do, it's perfect.
Denise's passion is tending to her show dogs, but had trouble doing that due to chronic pain in her hands until she met Dr. Traum. To find out more about Denise's story and other life-changing stories, log on to bestdocsnetwork.com. Best Docs Network DFW is presented by Forest Park Medical Center. Extraordinary is all we do.
17 years ago, I fell at work. I've had 4 surgeries total, and after that, I've been through massage therapy, I've been through acupuncture, I've been through the deep massage therapy. Nothing seemed to help with the damaged nerves that was there. I've been to doctor after doctor and after doctor, and finally, after years of that, it's like, why go anyplace else? Nobody can help you. There's nothing to help with the pain. So you just take lots of over-the-counter medicines and try to keep going because you still have to work and feed your family. I was introduced to Dr. Beck here at work. He said he had a new product, new technology out that would try to help with chronic pain. And he had heard that I'd had some knee problems and knee pain, and so he wanted to try it and see if it would work for me.
The P-Stim was actually a device that has been in Europe since about 2000. And it was FDA approved in the US in 2006. The reality is that there is a lot of skepticism initially with using P-Stim, but I've read the articles, I read the journals, I spoke to patients, and I came to realize that this actually will be beneficial to patients. Once the device is secured behind the ear, mapping of the ear occurs, where I locate nerve endings on the ear which correlate to areas of pain in the body.
It was a very non-invasive procedure. It used little electrodes that gave little impulses. There was no medication involved where you could still drive and work and those kind of things. Your head was still clear, you weren't foggy with it. It makes your day go a whole lot better.
P-Stim is not going to fix her knee, and she will get her surgery to replace her knees. But P-Stim has been able to control or manage her pain so that she's able to focus on other things outside of her knee.
After having 17 years of pain and having this very non-invasive P-Stim placed and being pain-free and being able to do the things that I want to do with my 10-year-old daughter, the whole world has totally changed for me.
What I find rewarding about P-Stim is that I can finally offer patients a non-pharmacologic way to help patients manage their chronic pain.
In spine surgery, one of the main surgeries that we've used has been the spinal fusion. The spinal fusion has been done for many years, and one of the things that we do with the spinal fusion is that we are trying to make 2 pieces of bone fused together. Stem cell research has allowed us to create a fusion without taking actual bone tissue from the body. What that does, it makes it so that you don't have to have an additional incision and you don't have to deal with the postoperative problems that are associated with a bone graft. What we do to obtain the stem cells is we actually place a needle into the iliac crest rather than doing a large incision. We draw out the bone marrow that's rich in the stem cells, and then we take that and then spin it down. We then collect the stem cells and place that in the area where we want the fusion to occur with additional bone. What this allows is, or what this changes, is that we now don't have to make a big incision, which can be painful after the surgery or be deformed after the surgery. Once we've collected the stem cells from the iliac crest and we've concentrated them and spun them down, we will place them on a piece of bone like this. Basically, there's different types of bone that we use, and this is what we call cancellous bone graft. And then we'll place the stem cells in there and place this actually in the area that we want to fuse. This is a piece of allostem. This is stem cells that have been collected from fat cells and they've been placed inside a bone matrix. They're attached to actual pieces or of bone. They come to us frozen in the operating room, and I take it and I thaw it out, and then I place this bone into the area where I want the fusion to occur. Now this has the stem cells impregnated in it, so these stem cells will actually turn into bone over time. This is called osteogenesis, or bone formation. Basically, the stem cell develops into a bone formation cell called an osteoblast. That cell then develops into an osteocyte, which is the mature cell. So basically what this stem cell does, it takes a lot of these cells and drives them toward forming osteocytes, which form the bone, which cause your fusion to occur. Our goal is to obtain pain freedom with stem cell technology.
What we do here is what's called a dermatopathology laboratory. It's a special type of laboratory where we look at skin biopsy specimens primarily. We get a few other things, but the vast majority of what we get are skin biopsy specimens. We see a large number of cases on a daily basis, so we see just about everything in the textbook over the course of a year.
By helping him, it allows him to do more and read more cases, be available to more physicians, while I do some more of the little stuff.
We have kind of an integrated approach where in the mornings, we come in and we look at the slides first. This is a 24-hour operations lab, so the slides are available at 4 in the morning, even if you want to come in that early, and sometimes we do. Then, when he comes in, he reviews the slides, and we're there with him. So he gets an opportunity to see what our impressions were, and you learn, he can kind of give you an idea of whether you were on base and doing it correctly, or if you needed a little more work.
As dermatology residents, we come to Dr. Cockrell's lab every week, sometimes multiple times a week, where he teaches us at the microscope his specialty, dermatopathology, for which he's world expert, so it's a great opportunity.
The fellows are a very good resource for us. They help us with some of the mundane type of tasks that have to be done in the laboratory, but they're also very creative, and we work together on a number of projects. We've published papers, textbooks, many articles together. We've actually done some significant research work that's been published in major scientific journals with some of the fellows over the years.
It's an honor to work with Dr. Cockrell. He is one of the best, if not the best, in his specialty. As a person, he has an amazing ability to recall information in a short amount of time. We consider him as to be the walking Bible of dermatopathology.
It's been an invaluable opportunity to learn from someone who is not only world famous in his field, but a phenomenal teacher and physician.
I think they learn from me, but certainly I enjoy interacting with them, and I learn things from them too.
For more information on any of the doctors you've seen on today's show, head to the website. It's bestdocsnetwork.com. Now it's time to head to our next doctor. If you have foot problems, this is the doctor to see, Dr. Ed Singleton.
A bunion is a bony deformity, a structural bony deformity that is painful with wearing any type of enclosed shoes. It's an inherited thing. Mom, Dad, Grandma, and Grandpa give that to you.
I had one of them surgically removed about 9 years ago. It was a very unpleasant experience, long. The healing time was probably prolonged because of the treatment. So I put off getting my feet fixed.
The mechanics that cause the bunion quite often are associated with the same thing that causes the hammer toes. And there's different degrees of hammer toes. Jeannie came to see me complaining of severe pain. She had had bunion surgery a number of years in the past in a different state. And because of her experience there, she was very reluctant to have this current bunion looked at and taken care of.
My mom and I started looking and researching, and I just decided to pick Dr. Singleton. Liked his personality. He was very clear and concise about the surgery.
Bunion surgery usually involves the cutting of the bone and shifting the cut fragments over to realign the joint, to take the compression forces out of the inside of the joint. If you just take the bump off, that's where bunion surgery has in the past, I think, got a bad reputation. By just taking the bump off, you've done nothing to correct the mechanics that's causing the bump to develop in the first place.
The right foot's healed up really good. The left foot is well on the mend. I can wear my tennis shoes today. My mother and I just, I hit the ground running, and I mean to tell you, as soon as I could get up and walk around, I did.
It's really relatively soon after surgery for her to be doing as well as she's doing right now. She's been a fabulous patient. She's done everything we've told her to do, and that helps so much in a person's recovery after surgery.
So I achieved my goal through this surgery and coming to Dr. Singleton and the surgery that he performed, and I am enjoying pain freedom with my feet, able to do more.
"12 years ago, I was in a car accident, and I had pretty messed up discs. So after 10 years of being in pain management, you get to a point where you're on so much medication and you're still in pain. At the end of the day, you know, you have a hard time trying to get through the day because the medications get stronger and more intense over the years.
We've had many patients who have come to us who have either been on medications for a long period of time or had the perception that they did not feel like their normal self, that they felt sluggish, they felt mentally slowed, some mental dullness. And one of the beneficial effects of hyperbaric oxygen therapy is it increases blood flow to your brain, and it perfuses the brain and all of your neural tissue with higher levels of oxygen.
About 3 days after my third hyperbaric oxygen treatment, I woke up in the morning and it was like, wow, my brain was functioning again. I felt better than I had in 10 years. And after 11 treatments in the hyperbaric oxygen chamber, I significantly reduced the amount of pain medicine I was taking.
One of the benefits that we've seen is many of our patients who've been on multi-drug regimens have been able to eliminate one or more drugs from their regimen or go to a reduced level of narcotics usage, whether it's Vicodin or OxyContin, and they seem to have the same pain relief with smaller doses of medication.
After 11 hyperbaric treatments, I was down to breaking one pill up in half and in half again because I was afraid to take too much of it. Before that, I was afraid to stop taking the pain pills. One, because I had pain, but two, also because they tell you you're supposed to step down off of them.
Chronic pain patients will have pain for the rest of their life. Frequently, we will do 5 or 10 treatments and then go on to potentially a maintenance program where we may do once a week or twice a month, and they continue to experience the beneficial effects of the hyperbaric oxygen and sort of keep them on an even keel, on a plane of improved function.
I was just amazed. 3 days of hyperbaric treatments, and I felt good.
Vicki had sinus pressure with pain every day until she met Dr. Joshua James. To find out more about Vicki's story and other life-changing stories, log on to bestdocsnetwork.com.
When somebody comes in and they are interested in weight loss surgery, there are basically
problem with the band, it takes longer to lose weight, 3 to 4 years according to Dr. Swanson, unlike the sleeve.
The advantage of the sleeve is that when you remove part of the stomach, you change the communication of your insides. Their stomach and their brain and their fatty tissue communicates and says, you need to live at 300. When you change that communication, on the day of surgery, their brain now thinks you should weigh 360.
So that is one big advantage of the sleeve, just like the bypass.
Because we physically divide part of the stomach away so that it no longer is in contact with the stream of food. So we know that if you stop food from contacting the very first part of the intestine, the duodenum or duodenum, that diabetes is dramatically improved. Diabetes is a horrible disease. And if you can cure that, that's why I do this. I want these people to be well. I want them to be healthy. I want them to be happy and live long. That's why I do this.
Facial skin rejuvenation is nothing new. There have been several treatments over the years to work at this, whether it be topical applications of medication and whatnot. Lasers really started entering the arena several years back with different types of wavelengths and lasers. Probably the most popular and most effective right now is CO2 Fraxel. However, there are certain skin types that just are not really safe for CO2 Fraxel. What we really love about the Revlite SI laser is that we're getting rid of skin blemishes. Everybody knows over time they've gotten the freckling and the age spots and everything else around the face. So literally we see those things come right off in a matter of days to weeks after treatment. One of my very first clients with this was my wife, and that should tell you how safe I think this laser is. I kind of like her.
When I was younger, I didn't really use sunscreen, and I loved being in the sun, and I thought using products like baby oil and butter would help my tan. In all actuality, it just burned me. And over the years, my sunspots have gotten much worse. So when we got this machine and I did the 532 pill, I noticed that that sunspot was not there anymore. If it's gonna, work that great for my face, it's gotta do wonders for my chest and my shoulders and my arms.
We're using lasers, and lasers are hot. They generate heat. That's how they do what they do. We use a customized topical preparation that's prepared at my pharmacy. We utilize an ultrasonic device that actually drives that medication into the skin deep, and then we use a chiller unit to actually cool the skin to get the best chance possible of minimizing this discomfort. And the trio works very well.
There's the 1064, which is the lighter treatments, which you can do every week, or the 532 pill, which you can do once a month for 3 treatments.
After a treatment, a lot of times we see some darkening of the freckles or pigmentation on the face, and then we have clients calling back a week later going, they came off in the shower today. And we're like, yeah, it's pretty cool. And several treatments on after that, we see skin turn absolutely into porcelain. It's a wonderful experience.
I love not having to put on any foundation or, powder if I don't want to. I just feel like my face looks so much better.
Asthma is an inflammatory disease of the lung. It affects the bronchi mainly. They develop inflammation that causes the bronchi to develop muscular spasms, and that gives the person a sensation of tightness.
I was able to play with my friends, but when I was running on the playground, it felt the same as it did in gymnastics.
Many times asthmatics cough a lot more than they wheeze, and because they don't wheeze, people don't think that they have asthma, and they don't get checked out for asthma.
I try not to pay attention to it because I didn't want it to interfere with my gymnastics and what I was doing.
She was saying she was tired all the time, she was falling asleep, she didn't want to go play, and she didn't want to do really anything.
In someone like Abigail, who's a child, they don't even realize that that's not normal. She thought she felt like everybody else did. And they don't report it to their parents or their doctor or anyone. We were just very lucky that we found that out.
I just decided that we would refer ourselves, and I looked up on the internet all these different allergists, and so we came here to see Dr. Baxter.
We started talking about how her chest sometimes felt tight. Her mother had not indicated that on the history form because she wasn't even aware of it. So then when we found out that her chest felt tight, we said, well, let's do a lung function, and her lung function was significantly impaired. So we had her try a bronchodilator treatment, and it came up 20%. She came up from about 60% lung function to 80% lung function just with one treatment. And then she said, wow, I feel so different. I feel completely relieved and I feel much more energetic and I feel like I can breathe. And her mother and I were just stunned because we really had no idea this was even going on in this child.
My life is so much better, and when I run at the gym and on the playground, I just feel like I'm a different kid.
It's wonderful. When she's talking to the kids, she said, I want other kids to know that there is something like this, and that maybe if they have it, they can have a different life too.
The Brazilian butt lift has become quite a popular procedure over the last few years. It addresses multiple procedures in one, meaning that essentially a Brazilian butt lift is usually full body liposuction to get the fat, and then you re-inject it into the buttock area to give the buttock a nice round, fuller appearance. The person that would be a candidate would be somebody that wants a fuller, more rounded appearance to the buttock, somebody that feels like their buttock is flat and doesn't have a lot of shape to it.
I wanted my stomach to be flatter, and then I wanted my butt to be bigger. Whenever I exercised to lose weight, the first thing that went was my legs and my butt, and then the last thing to go was my stomach.
The procedure is done in one setting, usually takes about 2 to 3 hours to do, and it also depends on how much fat the patient has. Obviously, we're using the fat to put back into the buttock, so if somebody's very slender, sometimes it can be a problem to get enough fat.
I wanted it removed from my upper back, my lower back, and my stomach. It doesn't feel like there's anything like how implants are. It doesn't feel like there's any implants or anything. It's just, I mean, it feels real.
Her results were very good. She got a nice appearance from the liposuction. We injected about 450 cc's or somewhere around there of fat into each buttock, which gave the buttocks a very nice round appearance.
So I've had a lot of people notice. Actually, last night whenever I went shopping to get some shorts for the summer, this girl was like, oh, I wish that my butt looked like that in those jeans. You have a really high butt, that's good.
I sit down with them in a very personal consultation and discuss the potential results I think I can get on that particular patient based on how much fat I think I can harvest from various areas of the body. And then I usually find one of my patients that has a body shape very close to what they are and show them pre-op and post-op pictures.
Dr. Frenzel made me feel really comfortable as one of his patients. I've had other surgeries. I mean, if I could turn back time, I would actually go to him because I just like the environment and I like the way that they care about you, and it was just an overall good experience.
Best Docs Network, DFW, is brought to you by Forest Park Medical Center. Welcome to the 21st century of cutting-edge medicine. Forest Park Medical Center. That'll do it. That'll wrap up another edition of the Best Docs Network, featuring some of the best physicians in the Dallas-Fort Worth area that, of course, help change people's lives. And for more information on any of the fine doctors you've seen on today's program, head to the website, bestdocsnetwork.com. If you have a question or comment for us, we'd love to hear from you. Send us an email at info@bestdocsnetwork.com. So long, everyone. We'll see you next week.